Replacing a tooth after an extraction is more important than you may think. More than just a cosmetic treatment, replacing missing teeth can restore critical chewing function, reduce or limit jawbone loss, and lead to improved overall health. Let's review the most common options for replacing a missing tooth. A removable partial denture. A removable partial denture replaces 2 or more consecutive teeth. This appliance uses clasps to attach the other teeth in the arch and can be removed by patients for easy hygiene maintenance. Partials are relatively inexpensive, but can also exert pressure on the supporting teeth, which reduces their overall lifespan. A fixed partial denture, or bridge. A bridge is also a partial denture in that it can replace a few missing teeth. However, it is not removable by the patient. A bridge is permanently cemented onto the supporting teeth by your dentist. The most popular type of bridge consists of 2 or more crowns that are supported by your own teeth on either side of a missing tooth. An artificial tooth is attached to the anchor teeth, creating a bridge. Be advised that bridges require healthy teeth on both sides of the missing tooth space for the necessary attachment and support. A dental implant supported crown. A dental implant supporting a crown is the only tooth replacement option that replaces the entire missing tooth, including the root. This anchorage in the jawbone provides the best chewing function and the most natural cosmetic appearance when a tooth needs to be replaced. They also have the best function and long-term prognosis, rarely needing to be redone once the implant has stabilized in the mouth. Maintaining great oral hygiene at home and keeping regular dental visits is the best way to prevent the dental disease that most commonly causes tooth loss. If you already have a missing tooth or are planning an upcoming tooth extraction, discuss your replacement options with your dental team today.